In this video, we'll discuss about intracellular accumulation. This one very important, not only to know what are the compound or minerals accumulate within the cell. At the same time, pathology point of view, it is very important to know what are the special strain that we have for this particular molecules. First, let enumerate all the substances that can accumulate within the cell. We are going to describe each one. So, what are the intracellular accumulation are possible? Intracellular accumulation broadly categorized into three. The first one are pigments. Second category, substances like lipids, you can say fat, glycogen and proteins, and the last thing are important one, calcification, calcium within the cell. First discuss pigment. Examples melanin, hemosiderin, lipofuscin, carbon, homogenetic acid and copper. These are the examples comes under pigment. First discuss when pigments accumulate inside the cell. Now the examples of endogenous pigment is melanin. So first thing and foremost, melanin. It is the endogenous pigment. It is produced within the body. It is not enter from outside. It produced within the body. It is responsible for giving color to the skin, hair, eyes, that is eye color, that is iris, also in the brain. Where the melanin present, it is substantia nigra. Substantia nigra. So these are the locations where this particular pigment going to be seen. So what are the places? Skin, hair, eye color, that is iris, and brain, where it is present, substantia nigra. Then biochemistry, what are the precursors of melanin? Biochemistry part, precursor of melanin, tyrosine. What need known about pathology point of view? How does this melanin appear on microscopy? The melanin, first of all, on light microscope, H&E stain, hemotaxin and eosin staining. Hemotaxin and eosin stain appear on basal layer. One additional color you can see here, brown color. Brown black pigment. What is melanin? This is the slide of the skin. The basal layer of skin actually seen in brown black pigment. Basal layer of skin seen brown black pigment. Any special stain we can use for melanin? Manson-Pantana. The special stain name is called as Manson-Pantana. This special stain we are used for melanin. Manson-Pantana. When we stain with the microscope, what color possibility we will get? This black color possibility. So special stain name is called as Manson-Pantana. Here black color possibility. So the pigment is brown black. Mansion bandana also black color possibility. So this was the first pigment we discussed. Let's move on. Next pigment name is called hemosiderin. Second pigment name is called as hemosiderin. What is hemosiderin? It is a pigment is formed whenever there is hemorrhage. Whenever there is hemorrhage or hematoma formation. It is a pigment formed whenever there is hemorrhage or hematoma formation, can result in the formation of hemosiderin pigment. Whenever hemorrhage, whenever hematoma, a lot of RBC are present. Lot of RBC is present. What is there in RBC? Hemoglobin. It containing iron. So indirectly hemosiderin composition is iron. So we need to know what is the color of regular microscopic examination. Regular microscopic examination of hemosiderin intends to golden yellow color. Most important point, the pigment is reflected. It should be shiny and refractile. Golden yellow color, shiny and refractile. It is the very important characteristics. Finding of this particular pigment. Golden yellow refractile. Is there any special stain that we used for this pigment? See the image. The image lot of blue color dot is present. This stain, the special stain name is called as Prussian stain or pearl stain. This special staining name is called as Prussian stain or pearl stain. It will give blue color. So second one is hemosiderin. Special staining name is called Prussian stain or pearl stain. It producing blue color dots. Third stain name is called, third pigment name is called lipofuscin. If you break the term lipofuscin, lipho means something to do with a lipid. This is also known as lipochrome. Chrome means color. What to do with lipid? This is formed due to lipid peroxidation. What we need to understand, as we age, due to aging, a lot of damage and insult that are faced in our body that result in lipid peroxidation. This lipid peroxidation result in the deposition of pigment, that is lipochrome or lipofuscin. So this happening with age. So this one is called senile atrophy. Next, because of this particular pigment that with or dealing with is happening with age, wear tear pigment, and lastly free radical injury. All of these we can discuss the name of some strains or pigment of lipofuscin. Next one is brown atrophy. That is because of color. This particular slide, if you see, this is cell, this one is the nucleus, there is yellow, this one is nucleus, there is yellow brown pigment. That is most characteristic binding, most important characteristic binding. These tend to be very nuclear deposition about lipofuscin. Lipofuscin have any special strain? oil red O, Sudan black B, then osmium tetroxide. These are the stain used for lipofuscin. What are the three stain? Oil red O, Sudan black B, then osmium tetroxide. These are the main pigment we have in our body. Some miscellaneous pigment also important for us. So fourth one, first miscellaneous pigment, carbon. It also called as arthrocardic pigment. Carbon is also called as arthrocardic pigment. This is black pigment. Carbon is black pigment and it is exogenous, sometimes seen in lungs. Air pollution due to smoke. People was chronic smoker, lot of carbon deposited lungs that gives the black color. Carbon is also known as arthrocardic pigment. Next pigment name is called homogenetic pigment. Homogenetic acid. Any disease related with the homogenetic acid? Alkaptonuria. What happen in alkaptonuria? There is deficiency of homogenetic acid oxidase. Deficiency of homogenetic acid oxidase. If homogenetic acid absent, where homogenetic acid further on the cycle, no, it will accumulate. Where it does accumulate? In nail cartilage and also passed out in urine. So this homogenetic acid accumulate in nail cartilage and also passed out in the urine. As a result, the color of urine black discoloration. In biochemistry part, when homogenetic acid oxidase comes out in urine, when the patient passing urine, the color of urine is normal. If you collect in a test tube, allowed it stand in the laboratory, it will turn black because the urine contain homogenetic acid oxidase. When homogenetic acid oxidase get deposit in the tissue, it have that name achronosis. When it will deposited in the tissue, it have that name achronosis. Sixth pigment, copper. What is the disease if copper accumulates? It is known as Wilson disease. What is the main defect? There is deficiency of ceruloplasmin. Ceruloplasmin is the copper transport protein. If there is deficiency of ceruloplasmin, the copper is going get elevated in the blood and will ultimately deposit. What are the special stain for copper? Rubianic acid and rhodonine. What are the special stain for copper? Rubianic acid and rhodonine. So, deficiency of ceruloplasmin causes Wilson disease. Ceruloplasmin is the copper transported protein. If there is deficiency in ceruloplasmin, the copper is going to get elevated in the blood, will ultimately deposit. What are the special stain for copper? Rubianic acid and rhodonine. Where it will deposit, where copper will deposit? very important example in the eyes. In Wilson disease, the copper will deposited in the eyes. In the eyes, what it is deposited in deciment membrane of cornea. Where it is deposit? Deciment membrane of cornea. What is the special appearance is known as KF ring. Kaiser Bleaser ring. KF ring. Other in the eyes, copper deposited in the liver where in the formation of cirrhosis, liver cirrhosis. And last, copper can deposited in the brain. Which part of the brain? Basal ganglia. Basal ganglia. So ultimately Wilson disease involved in triads, involved in 3 organs: eyes, liver and brain. In eyes, it will deposited in deciment membrane of cornea. The special appearance KF ring. Second one is liver, it causes cirrhosis. Third one is brain. Which part of the brain? Basal ganglia. So it involved in triads. Involvement of 3 organs. Second category. First one is lipids or fat. Which is the most common lipid which is accumulate in the cell? Common form of lipid, triglyceride. Then which is the most common organ where lipid deposition occur? In the liver. When lipid accumulates in the heart, what is the characteristic appearance? Tired effect or tabby cat. Tired effect or tabby cat. This one is the schematic diagram of heart. This one is the normal brown red. This one is the yellow color. This one is the yellow color is fat accumulate. This brown red is the normal heart color. We are seeing alternative brown red yellow. Such alternative band such as known as tiger effect or tabby cat. What are the special stain required to lipid or fat? Oil, red O. What color it will give to fat? Many orange color. Deposit or seen. These are nothing but lipid accumulation. This orange color deposition. This one nothing but lipid or fat accumulation. Oil, red O. Second one is second stain, Sudan black B. It gives black color deposition. It gives black color tablet. Third one is osmium tetraoxide. It also gives black color. After lipid, second one is glycogen. Glycogen will deposit which disease? Glycogen storage disease. Second one is a diabetic mellitus. So glycogen deposited disease. First one is glycogen storage disease. Second one is diabetic mellitus. Under these two disease, glycogen deposited inside cell. So what are the special stain of glycogen? Pass stain. Per iodic acid SIF. PAS stand for per iodic acid stiff stain. What color possibility will get? Pink color. So special stain, PAS stain. Per iodic acid trypsin, it gives pink color. Next, second category, third one is protein. What we need to know about this protein? These are certain condition. These are the certain condition in which protein start accumulating within the cell. The first condition, there is something known as Mallory-Hyrene bodies. Mallory-Hyrene bodies. They can be seen in multiple conditions of liver, but very commonly seen in alcoholic liver disease. So first condition, Mallory-Hyrene bodies. This one seen in multiple condition of liver, especially alcoholic liver disease. These Mallory-Hyrene bodies, these are protein molecules. What are the protein? Cytokeratin 8 and 18. These protein accumulate inside the cell. So Mallory-Hyrene bodies is a protein. Protein name is called cytokeratin 8 and 18. These protein accumulate inside cell. Second examples we need to know in a tumor is known as multiple myeloma. Multiple myeloma. The basic concept we need to know as this multiple myeloma is a tumor of plasma cell. This multiple myeloma is a tumor of plasma cell. Plasma cell. What do plasma cell? It produces the immunoglobulin. What is multiple myeloma produced? It will produce the more and more immunoglobulin. These immunoglobulin nothing but protein. How they accumulate inside cell? C2 plasma cell. Nucleus in plasma is always pushed to periphery. Nucleus is always pushed to periphery. If the protein start to accumulate in cytoplasm, okay, here that protein accumulated in cytoplasm. Which protein? This immunoglobulin, we call them Russell bodies. Russell bodies. If the immunoglobulin accumulate in the cytoplasm, we will call this Russell bodies. If the immunoglobulin accumulate in the nucleus, if the immunoglobulin accumulate in the nucleus, we will call them toucher bodies. Toucher bodies. So immunoglobulin accumulate in that cytoplasm, name is called Russell bodies. If the immunoglobulin accumulate nucleus, it is called as toucher bodies. In both cases, immunoglobulin in plasma cell, but location is different. In Russell bodies in cytoplasm and toucher bodies, location is nucleus. Third protein is known as misfolded protein. Third protein name is called misfolded protein. We know protein are going to form a rough endoplasmic reticulum. So protein are going to form rough endoplasmic reticulum. After the rough endoplasmic reticulum formation, they undergo folding of protein. This rough endoplasmic reticulum undergo folding of protein. Folding of protein is very important. If it does not happen, if this one folding not happen, means this misfolded protein will accumulate within the cell. If folding not occur, means it will accumulate within the cell. What is going to it? There is going to be something is known as chaperone. So folding is something is known as chaperone. Example, heat shock protein. These are helping to be folding of protein. This chaperone helping to be folding of protein. If there is defect in folding of protein, what will happen? Misfolded protein. This misfolded protein accumulate within the cells. Then what are the conditions this will happen? Example, Alzheimer's disease, then Parkinson's disease, Huntington's disease. These are those conditions misfolded protein implicated. So what are the disease? Alzheimer's disease, Parkinson's disease, then Huntington's disease. These are those conditions misfolded protein implicated. Third category, calcification. You can say pathological calcification or heterotrophic calcification. It is primarily two types. First one, dystrophic calcification. Second one is metastatic calcification. Dystrophic or metastatic calcification. This dystrophic calcification is happen in dead and degenerating tissue. So all the cells and tissue will show dystrophic calcification. Opposite to this metastatic calcification, this seen in normal tissue. That is the different number 1. Different number 2, serum calcium level of that patient is normal. Calcification is happening. There is some dead cell or tissue. So not because of elevated calcium level of the body. This one completely opposite. Serum level are elevated, because of which they will go and deposited in the normal tissue. With this concept, we discussed the example of both category. First one is this dystrophic calcification. First example, dead parasite. Again, dead tissue. It can be seen in tuberculosis. Then it is seen in atheromatous black. Then rheumatic heart disease. These are the example of dystrophic calcification. Dead parasite, tuberculosis, atheromatous black and rheumatic heart disease. Then example of metastatic calcification, parathyroid carcinoma, multiple myeloma, lymphoma, leukemia, hyperpharyngeal squamous cell carcinoma. These are the examples. Thanks for watching.